Good afternoon, everyone. And as we are facing some little problem about the connection, but it's okay from my side, and I will start it now. Today is World Arthritis Day. When we are celebrating this day, it is important to go through the magnitude of the problem. Almost 18 crore people in India, they are suffering from osteoarthritis. And out of that, 15 crores from knee arthritis and 3 crores from hip arthritis. So in this context, it becomes absolutely essential to aware our community regarding this particular disease. So I will share my screen now. Is it visible? Is it visible? So as I told, 18 crore Indians suffer from arthritis, more than 15 crores from knee arthritis, which is 15 times more than Western nations. And about 4 crores Indians require total knee replacement. And in contrast to this, China only 1.5 crore people they suffer from knee arthritis. And most common arthritis prevailing in India is age-related arthritis, which is Azara Sandhivata as per Ayurveda. And average age of onset for Indian females is 50 and for males is 60 because of menopausal problems in females and other lifestyle related problems, maybe because this onset is a little bit more in females. Yes, knee arthritis is common in Western world. Hip arthritis is more common. Let's move on. So when we see the causes of Sandhigat Vata, as mentioned in our science, if we divide these causes into the subcategories, the nutritional causes, the consumption of dry and cold food, inadequate and light food, excessive sexual intercourse, excessive night vigil, wrong treatment, excessive blood loss, excessive loss of doshas, excessive starvation, emaciation from treatment, that is overuse of panchakarma treatment. And this nutritional factor alters the nourishment of joint and leads to early osteoporosis. Physical stressors such as long swimming, long walking, excessive exercise, long time activity, sleeping on uneven bed, traumatic injuries, injury to vital organs, and riding on fast moving vehicles, unstable vehicles. So these stressors weakens the joint by reducing the lubricant, what is called as Shleshar Kapha in our Ayurveda, that is present in joints. And this is this joint for early destruction. And the mental factors such as excessive worry, anger, and anxiety. These factors contribute further in the progression of the degeneration. About 12% of the arthritis are due to the traumatic injuries, as it is well mentioned in our science also, in the form of Abhigata. If you see the Sampropti of Sandhigat Vata from our science point of view, the acharyas they say that Desh Strotansi Riktani Puritva Anilo Bali Karoti Vidhan Vyadi Sarvang Ekam Sanshtan. And the clarification given for this Riktani it is Nehadi Gun Shunyani. That is, the aggravated Vata occupies the spaces in the body which are devoid of lubricants and gives rise to the disease. And due to the loss of lubricants in joint spaces, Vata gets aggravated joints and gives rise to the inflammation and the pain that we can infer upon. But as in contrast to this, when our students, they read the modern pathogenesis of uh, excuse me, please. Sir. तेच म्हटलं मग पुस्तकांचा इश्यू होता. बरं, ऍपल
चतुर्वेदीचा कॉलेज न्यू नंदनवन
चालेल सर. ओके, थँक्यू. ओके ओके सर. ओके, थँक्यू सर. थँक्यू व्हेरी मच. So sorry for the interruption. And exactly, the modern type of pathogenesis is also mentioned in our science. This is the shloka from Grantha called Nidan Pradeep. उत्तिष्ठं तु भवेत् द्वाभ्याम् अस्तिभ्यां सन्धिघर्षणं सन्ध्यास्थो च अत्र घर्षत्वात् शोपः ततो उभयभागतः. सन्धि अस्थो च अत्र घर्षत्वात् शोपः. There is rubbing of two bones in the joint over each other, resulting in swelling on either side. So this rubbing of two bones because of loss of cartilage results in inflammation and the pain in the joints. This is the loss of cartilage and exposed bones, degenerative meniscus, and these bone spurs is nothing but the osteophytes on the lateral side of the joint. So if you see the clinical features of Sandhigat Vata, there is some little disturbance. Dr. Shrikant, could you please mute that disturbing voices? So in features, we see the swelling of joints, the knee swelling like back, as if the back filled with air. Sandhi Shula, joint pain, and there is a Savedana Akunchan, that is painful flexion, and Savedan Prasaran, that is painful extension, and Astishosham, that is nothing but the loss of bone mineral density and the osteoporosis. And the feature Hanti Sandhi, mentioned by Acharya Sushruta and clarified by the commentators, is nothing but the painful extension and the flexion. We are going to see it in next slides also. So here you can see the swollen joint, this one, and this is the Shosha. Some other forms of osteoarthritis in Ayurveda. There is a book called by the Chintamani, wherein we find some terminologies like Astivat, Januvat, Kativat, Angulivat. This Angulivat is also the osteoarthritis of the fingers. So in Astivat, where the Chintamani mentions that Dehasya Kampanam Murcha Svedo Daha Agni Mantekaha. And in Januvata, there is Janu Shushkatvam, Kampo, and Janu Shulam. In Kativat, Katibhanga Vikari Mahashula. Then in Angulivat, there is important point is Anguli Kubja Bhavascha. So these deformities of the fingers, they are noticed in Angulivata, that is the osteoarthritis of the fingers. These deformity could be in the form of Hibberdon's nodes, and the formation of the curvatures and curving of the bones. In Madhav Nidana, in Vastigat Vada, Asti Parvanam Sandhishula, Mas Balakshaya, and Santataru, the continuous pain. And there is one more form of osteoarthritis that is called as Koshtuk Shirsha, in which there is significant swelling in the knee joint with associated with the severe pain is noticed. Now, there are two terminologies. One is Sandhigat Vata and another is Sandhivata. In the book called Vaidya Chintamani, as far as Sandhigat Vata is concerned, he followed the Sushuda's view, Hanti Sandhigataha Sandhin Shulashoko Karoticha. Because this Sandhigat Vata, Hanti Sandhin and Shulashoko Kartisa. There is inflammation and the pain. Whereas in Sandhivata, he mentioned Sharir Gandhaliptam cha Shulam Vayu Prakopataha Dehe cha Vikrutischa Romaharsha Pralapanaha Anga Sandhishu Pida cha Sandhivatasya Lakshana. Now, how to differentiate these two things, that needs to be thought over. But we will come to this point later on. Let us move further. Now, the complicated features of Sandhivata. Now, you see, Hanti Sandhi, the meaning of Hanti Sandhi given by Madhukosh is Sandhi Vishlesham Stambadikam Vakuruti. Sandhi Vishlesham is the dislocation of the joint. Another meaning is given by Atangarpan is Akunjan Prasaranayo Abhava. There is difficulty in extension flexion, or at all it is not possible. Or you can say that this flexion deformity can occur. And if you see the dislocations, the description of dislocations given in Sushruta Nidan Sthana and in the Nidan Pradip Grantha, there are 6 forms of dislocations they have mentioned. Utpishtam, Vishlishtam, Vivarditam, Avakshitam, Atishiktam, Tiryakshitam. Although, and the common features they have mentioned, that Prasaran, Akunchan, Vivardhana, Akshipan, Ashakti. That is difficulty in extension flexion and the upward movement, lateral movement, etc. Ugra Rujatvam, severe pain. Sparshasatva, tenderness is there. Although this is in mentioned in context with the Bhagna, but you see after as a complication of osteoarthritis, thereafter there are small hairline fractures. After in the end, there is tear in the ligaments also, and the total disruption of the joints can also occur. So these things also we need to take into account. So as we mentioned, Utpishtam tu bhavet dvabhyam astibhyam sandhigarshanam. Utpishtam occur because of the rubbing of two bones to each other, and sandhyastu atra gharshatvat. And because of that rubbing and destruction of the cartilage, there is inflammation, shofa, tata ubhay bhaga. That is, and pain typically increases at night. In Vishlishta case, Alpashopho Vedna Satatyam Sandhi Vikriya. Now again, the meaning of this thing, the Vishlishtam to Sandhi Vishlesha. See the Hanti Sandhi, the meaning of Hanti Sandhi given by Madhukoshkar is the Sandhi Vishlesh. And this Vishlishta type of Sandhi Vishlesh, that is dislocation of the joint. The second form, there is mild swelling, continuous pain, and restriction of movements. And Avakshipta form, there is some dislocation of joint with severe pain. In Vivartita, Vivartite to Sandhi Parsho Apagamanat Vishmangata, there is sliding of joint leading to deformity and pain. And Sandhi Parshvata, so this may be Genuvarus type of bowing of the knee joint to the lateral side. And Atikshipta is Paraspar Atikramanam Kriyam Ekasya Vadvayo Astuno Yatra Bhavit. So there is complete dislocation, and this bone cross each other in Atikshipta. In Tiryakshipta, there is bowing one bone on lateral side, and this Tiryakshipta may also appear in the form of Genuvarus type of deformity of the knee joint, as it is the most commonly affected joint due to weight bearing. But the although there is one line description of Sandhivata in Ayurveda, Hanti Sandhini Shula Shofo Karoticha, but if we take into consideration all these aspects together, then there is the proper meaning we can take out of it, that the basic fact, the two bones rub each other because of loss of cartilage, and that leads to the inflammation and the pain. Coming to the Ayurvedic aspect of clinical diagnosis, again, Trivit Pariksha, Darshan, Sparshan, and Prashna. In Prashna, we can set up a questionnaire, and in Darshan, we can see the position of the joint, situation of the joint, and the swelling. Sparshan, we can do the extension, flexion, see whether it is painful, and whether that Vaat Purna Dhruti Sparsha is failed. Coming to the therapeutic response, as mentioned in our science, the massage of joints with oil, ghee, fat, followed by fermentation, brings the relief. Similarly, the vata drugs, warm clothing, nutritious diet are all beneficial in this Sandhivata, whereas cold environment, cold substances aggravates the condition, which is usually noticed. Shita Samparkina Vata Buddhi, Vata Shulha, that is our theorem, and that is very well noticed in case of Sandhivata. Coming to the prognosis point of view, it is Kashtasadhya, and after in old patient, as long as treatment goes on, patient feels better. Coming to the principles of Ayurvedic treatment, in one line, Acharya Sushruta has mentioned that when the Vayu invades the Sandhis, in case of Sandhigat Vata, one should carry out the therapeutic measures such as Sneha, Upnaha, Agni Karma, Bandhan, Unmardananica. So, oilation, poultice, these cauterization for pain relieving, Bandhan, joint ligature, and we apply and Unmardan. So, the massage. So, Acharya Galana had clarified the Sneha here, that Sneha is not only it is the internal as well as external administration of the lubricant. So there is which is supported by Chakradatta, Bahya Abhentar Snehi, Asti Madhyagatam Vatam Chet. For Kloshtuk Shursha, they advise the Google with Guduchi and Trifla water, and with the Erenda Tela and Bruddhadaru. For pain and inflammation in Sandhyasadhyatva Vata, there are references to consume Adityapak Gugul, Sianath Gugul, Mahayuvraj Gugul, Trayadoshang Gugul. These are references from Chakradatta, Vaishali Ratnavali, and Yog Ratnakar. For erosive arthritis, where there are hairline fractures, you can use Laksha Gugul and Abha Gugul. And there is some important aspects as far as remedy is concerned. The Sutam, Lavangam, Karpuram, Jati Patrafalam, Shatavari. See the drugs used, Ashwagandha, Vruddhadarukam. The point is here to show Ayufenakam. So there, I didn't get the reference of Ayufen in other books, but the book called in the book called Ayurveda Abhisar, which is Ayufen, which can be the potent pain reliever. So the use of Ayufen along with this Ashwagandha and Vruddhadaru was in practice to elevate the pain of Sandhigat Vata. So this is the classical reference we get. But I wonder why this Ayufen or Vijaya is not currently being used in the newer formulations made by either the branded companies. Similarly, in Gada Nigraha, the Rasna is well known for anti-inflammatory action. Langli also anti-inflammatory and analgesic. So, and Ashwagandha, there's some steroid-like actions. That's why it may have been used. Some branded preparations, capsule Dazzle from Vasu, Maestal Fort from Soluming, and tablet Rumalaya Fort from Himalaya, Sallaki from Ufik. These are some potent drugs. Rubificients, Arnopen liniment from Phytopharma, Arjit spray, Dazzle oil, Inflanil oil, and Rumalaya liniment from Himalaya. Coming to some modern aspect of the disease, It is the commonest condition affecting the joints due to damage to articulating cartilage induced by complex interaction of genetic, metabolic, and biochemical and biomechanical factors leading to an inflammatory response affecting the cartilage, subchondral bone, ligaments, meniscus, and synovium, and the capsule. It is more common than hip osteoarthritis. It's common after the age of 55 years, and predisposing factors are hereditary factors could be there. Gender, females are more subjected to, more predisposed to the osteoarthritis. And the occupation, cotton workers develop osteoarthritis of hands. Miners, they develop osteoarthritis of knee and shoulders. Farmers, they develop osteoarthritis of hip and knee. Sports person, jumpers, athletes, because of high incidence of lower limb osteoarthritis. And trauma to the joint predisposed to the osteoarthritis. Meniscal and cruciate ligament causes osteoarthritis of the knee ultimately. Obesity put the extra skeletal mass and extra burden on joints of knee and hands. Other primary causes are not known, but secondary causes with pre-existing joint damage could be with rheumatoid arthritis, gouts, spondyloarthritis, septic arthritis, Paget's disease, vascular necrosis of the bone, systemic disease such as hemoglobinopathies like sickle cell anemia, hemophilia, metabolic disease, acromegaly, because of disbalance of the growth hormones, cartilage calcification, hemochromatosis, which is excess deposition of iron. Coming to the etiopathogenesis, intra-articular cartilage is a matrix of collagen fibers enclosing a mixture of proteoglycans and water. There is dynamic balance between cartilage degradation by wear and its production by chondrocytes. In the development of osteoarthritis, this balance is lost and the cartilage becomes edematous, followed by the erosions. Cartilage ulceration exposes the underlying bone to the stress and microfractures, which I was referring as hairline fractures. The bone attempts repair but produces abnormal sclerotic subchondral bone and overgrowth at the joint margins, that is called as osteophytes, which is evident on the radiological imaging. Features: the morning stiffness, stambhadikam as mentioned in our science, the joint pain on movements, and the restriction of movements, restriction of particularly the flexion. There is joint crepitus, atopo, sandhiato, which is mentioned as in our science. There could be joint effusion. Hand osteoarthritis, nodal osteoarthritis in postmenopausal women, painful. Swollen interphalangeal joints, impairment of hand functions, sometimes painless bony swelling, it is called as Heberden's nodes, are also noticed. Where the stiffness and deformity is there, the curving of the hand and the fingers may also occur. Knee osteoarthritis, the medial compartment is most commonly affected, leading to varus type of deformity, that is bowed legs, arching of legs, lateral arching of the legs. And hip osteoarthritis is associated with acetabular dysplasia and labral tears. Physical diagnosis, inspection by viewing the joint condition, palpation by flexion and extension. Patellar tap test for effusion. Patellar tap test is you move 4 or 5 times from upward to downward on thigh and collect the fluid, maximum fluid in the knee joint. Then just with your finger, just tap on the patella and just see whether that patella goes down and comes upward and touches to your finger with ballotment type of movement. That is the patella. If that is positive, that suggests the collection of fluid, effusion. Progression assessment: if there is a loss of joint space by more than 2 mm within a year, it is considered as accelerated progression. That's the way we can assess the degradation, degeneration. Investigations, blood tests, nothing is significant except then slight elevation of CRP. X-ray shows loss of cartilage and osteophytes. As you can see here, these osteophytes and the lateral borders, bone spurs, and this, you see, normal joint. This space is joint space is very well maintained, whereas this is decreased in case of osteoarthritis. Similarly, here there is a eroded cartilage. In MRI, you can notice the meniscal tear also. In arthroscopy, arthroscopy may reveal fissuring and early erosion of the cartilages. Synovial fluid analysis may show few leukocytes. Again, here in osteoarthritis of hip joint, this is a normal figure where we show the joint space is very well maintained, whereas in this case, the joint space is reduced. Here in case of knee joint X-ray film, where the normal joint space is maintained, whereas in case of osteoarthritis, the loss of joint space is noticed here. So these are deformities, Iberden's nodes, these osteophytes, scoring of the bone is noticed here. Bony enlargement. This is hyperextension of the first metacarpophalangeal joint. These are noticed. And osteoarthritis of hand. And the osteoarthritis of lumbar spine. If you see this normal joint where this cartilages and joint space is very well maintained, whereas in case of osteoarthritis, this disc is flattened. Disc is flattened. Here, you see the disc is very well maintained, and here the disc is flattened. And this flattened disc may protrude out and may in turn compress the nerve. So here you can see in normal film, this space is very well maintained, whereas the disc space is reduced here. It is reduced here. You can see some MRI images, the normal disc space, and this unhealthy disc. And in this, you can see here is the compression of the nerve because of this spinal canal because of this protrusion of the disc at the level of L3 to L4. Complications: complete breakdown of cartilage, chondrolysis, bone death, that is osteonecrosis, crest fracture, hairline cracks, that is bleeding, infection, rupture of tendons and ligaments causing loss of stability, compression of nerves in case of spinal osteoarthritis, as I already told you. So complete disruption of the joint and dislocation of joint may also take place. If you see the differential diagnostic conditions, first the rheumatoid arthritis, which is characterized by moderate fever, multiple joint involvement, and the involvement is symmetrical. Joint is warm, tender, swollen. There is a remission and relapses. ESR and C-reactive protein is raised, whether and RF factor may be positive. Anti-CCP antibody is positive. And complications such as polyneuropathy, carpal tunnel syndrome, splenomegaly, etc. may occur. Gouty arthritis typically begins from the toe with a great pain and morning stiffness. There is moderate fever. Gouty toffees may occur, which may burst in the eventually. And there is history of alcohol in 50% of patients. Serum uric acid is raised. In reactive arthritis, for example, tubercular arthritis, there may be history of pulmonary coughs earlier, usually monoarticular arthritis affecting hip or knee joint in 30% cases, sacroiliac joint in 20% cases, and spinal in the rest of the 50% of the cases. There is insidious onset of the pain with joint swelling, with general symptoms of tuberculosis. And if you analyze the synovial adenosine deaminase, it may be positive there, which may ultimately gives the diagnosis of reactive arthritis. Septic arthritis results from the pyogenic microbes. The patient typically presents with a single painful joint, which is often knee joint. Joint is warm, tender, and swollen, and fever is common. And if you analyze the synovial fluid, it may show the interstitial C. Rheumatic fever, which is due to streptococcal infection. Wrist or knee joint may become acutely painful or swollen for 2 days, and there is carditis also in the form of murmurs. This, which is the clinical manifestation of it. This arthritis lasts for few weeks to months and resolves completely without long-term problems, and ASO titer may be raised. Psoriatic arthritis in 10% cases of psoriatic patients, which is a polyarthritis affecting the small joints, small and distal joints. Diagnosis entirely clinical. Lyme's disease because of spirochete occurs in children. It lasts for only 1 week, and it can be easily taken, excluded from osteoarthritis. Still disease, again a juvenile condition observed below 5 years, and this is also can be easily excluded from the osteoarthritis. Systemic lupus erythematosus, as you all know, connective tissue disorder involving the capillaries, arterioles, venules, and there is a typical butterfly type of distribution from nose, bridge of the nose, and these cheeks, and antinuclear antibodies may be present here, and with other systemic features. Ankylosing spondylitis, which is a very common condition and should be taken for the differential diagnosis of osteoarthritis. It presents as an insidious onset of low back pain and morning stiffness, which is commonly noticed in young adults. Men and women both are commonly equally affected. There may be HLA-B27 antigen found in this condition. Pneumoarthritis, it may be due to trauma or surgical intervention, and vitamin C deficiency arthritis, it usually affects the children. In my entire life, I had seen only one case of vitamin C deficiency arthritis, but we mistaken initially we mistook it as juvenile rheumatoid arthritis. Then with the ultimately with the gingivitis and bleeding gums, after some 4 or 5 days, we were able to diagnose it as a case of vitamin C deficiency arthritis. Treatment, modern treatment, analgesics, NSAIDs, they are, although they are very potent in relieving the pain, but they have very bad side effects. Can cause renal failure with a single dose of NSAIDs. So should be used very judiciously as per the condition. COX-2 inhibitors can be preferred. Intra-articular injections, steroid injections, the routine practice of triamcinolone and methylprednisolone. I had given a lot of these intra-articular injections, and methylprednisolone results were very satisfactory. The result, the relief lasts usually for 3 weeks to 6 months, and in some cases, one gets the permanent relief. But in most of the cases, problem re-aggravates after 3 weeks or 2 months. So you have to give, but we should not give it quite frequently, but twice a yearly can be done. Another option is of hyaluronic acid, which is nothing but the cartilage substance, and injection available in the market is Hyalgan. I had given this. It comes in the rate of 1,500 and 15,000. So 15,000 is a single dose, and if you choose for those 1,500, you have to do 6 doses. So result is not that, even after spending that much of the amount, the result with the hyaluronic acid is not so encouraging. So that's why I do not prefer much, but those whosoever are rich enough to afford it, I suggest. And somehow Depo-Medrol nowadays it's not available, and triamcinolone is easily available, and nowadays we are giving triamcinolone. And physiotherapy, of course, the mainstay of treatment. Thank you very much. These are my 2 books wherein you can find the entire description of these conditions and other variety of conditions. So you can go through it, and you can contact me on this number for any further queries. And my two other colleagues in the college, they are going to lament upon the treatment of the Sandhivata and the other arthropathies from Ayurvedic point of view. So now I will call upon them, and if there are any questions regarding this session, we can take it later. And now with this, may I call upon Dr. Amol Khatri sir to present his presentation.
Yes. Is this visible, sir?
Yes, yes. Go on.
Yes. Just a minute, sir. Sir, please. Am I on? Am I
Yes, you
audible,
are
sir?
audible. Yes, you are audible. Go on. You are visible and audible. Go on, please.
Okay. Thank you so much, sir. First of all, a very good afternoon to all. Myself, Ganesh Das Khatri. I'm the assistant professor in the Department of Panchakarma at Jupiter Ayurvedic College and Tarini Hospital, Nagpur. So, friends, on the occasion of arrange this webinar on the arthritis, the role of Panchakarma in arthritis. So, let's start the first slide. As we all know that there are two types of common arthritis we encounter in a day-to-day OPD practice or in a hospital. Osteoarthritis and inflammatory arthritis. Osteoarthritis is obviously crystal-induced arthritis, in which the uric acid crystals get deposited in the small joints, which we call that disease as gout. So these are the basic types. There might be a septic arthritis, or sir has highlighted some arthritis. So these are the basic kinds which we so on the next slide are the diseases. 1 minute. So in the next slide, we are going to discuss the Ayurvedic disorders which are having joint involvement in it. What kind of disorders are mentioned in Ayurveda? The first one is obviously Vata, which we all are familiar with. The name itself suggests Sandhigat Vata. Sandhis are involved in it. The second, Charaka has mentioned that Vatarakta is predominantly starts from small joints of the limbs, and the patient suffers from the severe pain in the joints. The next entity which is similar to the Vatarakta is Ratta with the Vata. internet issue. I think had left the meeting. So please let me know, is this visible?
Yes, it is visible and
Yes.
audible also.
Yes. The Ayurvedic disorders, we have seen Sandhigata Vata and Vatarakta, the similar entity which is explained in Vata is Rakta Vritta Vata. This is also, we can correlate this is also with Vatarakta, because in Vatarakta Samprapti, it is also been mentioned by Charaka that Raktena Avaritah Pati. When Vata gets avritta by, then that entity
फोन करत होती त्याला मी.
called as Vata. The similar entity is Rakta Vritta Vata, where patient suffers with Sadaha Arti, means the burning sensations, pain in the joints, Saragva Shwetu means redness and swelling in the body. Nearly most of the joints of the body are involved, and the pain is so severe that Acharya has mentioned that pain as Vrushchika Danshavata pain. So we all are familiar with all the disorders which involves joint, but are there only these kinds of disorders which are involved, which involves joints in them? No, but we know these disorders by their nomenclature. The next slide, I would like to highlight some important references for many practitioners or a young budding Ayurvedic practitioners or the students who mostly try to name any particular disease. In our science, Charak Sutrasthan first. Just a second. The network is so unstable. Please, sir, let me know if I'm audible or not this time.
You are audible. You are audible. Clear, very clear now.
Okay. So this sutra, there is no mention of the name of disease. Charaka has not mentioned that a physician should know the name of disease. He just mentioned that he should know the hetu and linga. On this basis, he can go for the medicines. The second one is the reference which we already know is dosha evahi sarvesham roganam eka karanam. Dosha are the sole culprit for any disorder which is happening in the body. Second, the next reference is also we are familiar with, and that says dosha dushya sammurchana janito vyadhi. The next reference which I would like to highlight on this is the important reference mentioned in Charak Sutrastan 18, where Charak says, Vikaranam kushalo na jinniyat kadachana nahi sarva vikaranam namo asti dhruvasthiti. It says that a physician should not get embarrassed or should not get depressed if he is not able to nomenclate that particular disease, because it is not possible to give a nomenclature to name any particular disease, because the diseases are so many. It is not possible to give a particular name to each and every disease. So why these diseases are many numbers? In Charak Chikitsa Sthan, Charak mentioned that Hetu Sthana Visheshacha Bhavet Vyadhi Visheshakrup. Means on the basis of various hetus, on the basis of various sthana sanshraya of those vitiated dosha, there are many disorders which are happening in the body, and that's why we cannot name each and every disease in the body. So physician should not go behind naming that disease, but he should focus on hetu, linga, dosha, visheshan. That's why the Charak is saying that tasmat vikara prakriti adhishthanantarani cha samutthana visheshascha gyatva karma samacharet. So physician should not name any disease, should not try to name any disease, but if he get information about the vikara prakriti, means vitiated dosha, about the adhisthana of those dosha, about the etiological factors of that to name every time a disease. If we know the hetu, if we know the lakshana, if you know the etiology, says hetu sthan visheshacha bhavet vyadhi visheshakruta. Now imagine this person having a particular hetu of blood clot, maybe encountered in that patient.
Hello, Dr. Amit Barbuje sir is there?
Yes, sir. I'm here, sir.
Because I think Amal sir is facing a lot of problem in network issue. Till he comes in a range, you can start your presentation, and I will ask Amal sir to come in the range and then cover the rest of our part. Okay?
Okay, sir.
You can start now, sir.
Okay, sir. Thank you, sir. Thank you so much, Wagi sir and Amol sir. Today we are going to discuss arthritis treatment. Okay, arthritis treatment to अपन I am Dr. Amit Barbuje, MD काय चिकित्सा, Associate Professor in काय चिकित्सा in Jupiter Ayurvedic Medical College. Okay,
आज आर्थराइटिस डे के उपलक्ष्य में अपन आर्थराइटिस के बारे में देखने वाले हैं। तो मैं ट्रीटमेंट के बारे में बोलने वाला हूँ, ठीक है। तो डायरेक्ट ट्रीटमेंट पे जाने से पहले मैं थोड़ा जो सिद्धांत है, क्या अपने को सोचना चाहिए पेशेंट के बारे में, पेशेंट की व्याधि के बारे में, तो मैं उसके बारे में थोड़ा सा बताना चाहता हूँ। ठीक, नेक्स्ट स्लाइड। फर्स्ट में तो वात व्याधि या संधिगत वात जो भी है, ठीक है। तो वात की विकृति से जो व्याधियां उत्पन्न होते हैं, ठीक है, तो उसको वात व्याधि बोलते हैं। वात की विकृति से उत्पन्न होने वाले वातेन जनित असाधारण व्याधि विशेष वात व्याधि ऐसे बोला है, यानी स्पेसिफिक डिसीजेस कॉज्ड बाय वात ओनली दैट आर कॉल्ड बाय वात व्याधि। ओके। तो अपन जैसे देखते हैं कि वात व्याधि है तो एक आध पेशेंट है, तो अपन उसको देखते हैं कि सामता है या तो निरामता है, ठीक है। तो ये कैसे जानेंगे अपन सामता है या निरामता है पेशेंट में, ठीक है। तो एक आध पेशेंट है जिसको मॉर्निंग स्टिफनेस रहता है, ठीक है, मॉर्निंग स्टिफनेस रहता है, पेन रहता है, तो उसको अपन एक ब्रॉडली एस्पेक्टेड बता रहा हूँ मैं, ये कुछ एकदम परफेक्ट ऐसा ही रहता है ऐसा नहीं है, लेकिन एक जनरल जो है ये, ठीक है, कि मॉर्निंग स्टिफनेस जहाँ पे रहता है वो अपन सामवात या सामवात व्याधि बोल सकते हैं। और जो मॉर्निंग स्टिफनेस जिसमें नहीं रहता और फिर होल डे में पेन रहता है, कम या ज्यादा जो भी पेन रहता है, उसको अपन निराम वात व्याधि या निराम आर्थराइटिस बोल सकते हैं, ठीक है। तो वात व्याधि के चिकित्सा करते समय जो है रुग्ण का जो है उम्र है, रुग्ण का बल जो है ना, और जो भी ऋतु वगैरह चल रहा है उसको देख के जो है अपने को ट्रीटमेंट करनी चाहिए, ठीक है। तो कैसा आयुर्वेद में जैसे जो अपनी एज रहती है ना, तो उसको 4 जो है आश्रम में बांटा है। जैसे 25 साल तक के ब्रह्मचर्याश्रम, 50 साल तक के गृहस्थाश्रम, और फिर उसके 50 to 75 तक के वानप्रस्थाश्रम, और उसके बाद में जो है संन्यास ऐसे बोला है, ठीक है। तो 25 साल तक के जो कोई एक आध पेशेंट आता है आपके बात में, जिसको आप डायग्नोस करते कि इसको आर्थराइटिस हुआ है, ठीक है, तो अपना ये सोचना रहना चाहिए कि उसको उसका वीर्य, अपन जो दवाई देने वाले हैं उसको, तो अपन थोड़ा स्ट्रांग वीर्य यानी उष्ण वीर्य की दवाई दे सकते हैं उसको। तो 25 साल तक के जो भी व्यक्ति आता है उसको अपने को चिकित्सा देना है तो अपन उष्ण चिकित्सा ही करेंगे उसको, ठीक है। उसके बाद में 25 से 50 साल के बीच में एक आध पेशेंट आता है, ठीक है, तो उसको अपन ऋतु अनुसार चिकित्सा करने की सोचेंगे, ऋतु का विचार करेंगे। उसके बाद में उष्णता शीतता है ना, वो पेशेंट को कैसे 25 से 50 साल के बीच में जिसकी भी उसकी कंडीशन है, व्याधि बल है और रुग्ण बल है ना, उसके अनुसार चिकित्सा करेंगे। बाद में 50 से 75 साल के बीच का कोई पेशेंट आता है जिसे वानप्रस्थ ऐसा बोलते हैं अपन, तो उसको संतर्पण ही चिकित्सा करनी पड़ेगी, उसको आप अपतर्पण करने वाली दवाई नहीं दोगे, ठीक है। तो समशीतोष्ण टाइप में संतर्पण चिकित्सा ही करना पड़ेगा, तभी उसको आपको वात व्याधि में जो है वो आपको रिजल्ट मिलेगा उसको, ठीक है। बाद में उससे भी एक आध ओल्ड एज पेशेंट आता है ना, 75 ईयर्स के ज्यादा वाला, तो उसको आपको वात व्याधि का अगर पेशेंट है, सामवात व्याधि लग रहा है आपको, ठीक है, या तो निराम वात व्याधि, अपतर्पण या संतर्पण जो भी है, तो भी उसका जो भी है जो उसका एज क्राइटेरिया को देखते हुए अपने को उसकी संतर्पण चिकित्सा ही करनी पड़ेगी और उसको शीतल द्रव्य ही देनी पड़ेंगी, ठीक है। तो शीतल द्रव्य जो भी वातनाशक है वैसे ही द्रव्यों से उसको संतर्पण चिकित्सा करके उसकी वात व्याधि ठीक हो सकती है, ठीक है। तो इसलिए कि जब भी ये आर्थराइटिस वगैरह होता है तो अपने जो जॉइंट्स रहते हैं, संधियां रहते हैं, तो उसमें जो आकाशत्व रहता है ना, गैप जो रहती है वो कम हो जाती है, ठीक है। तो अपने को क्या करना है कि वो आकाश तत्व जो रहता है या तो गैप को अपने को बढ़ाना रहता है, ठीक है। जैसे अभी आमवात का एक पेशेंट है, ठीक है, तो आमवात का पेशेंट है तो जैसे वो इन्वेस्टिगेशन वगैरह करके आया, जैसे आरए फैक्टर पॉजिटिव है, एंटीसीसी पॉजिटिव है, ठीक है, तो अपने को पता है कि आमवात का पेशेंट है, ठीक है। अपने भी क्राइटेरिया के अनुसार मॉर्निंग स्टिफनेस मोर देन 1 आवर वगैरह मॉर्निंग स्टिफनेस और बाकी के जो भी सिम्टम्स है उससे अपन आमवात डायग्नोस कर ले पेशेंट का, ठीक है। लेकिन वो पेशेंट का अगर आ रहा है आपको पेशेंट, आप चेक कर रहे हैं उस पेशेंट को, ठीक है, उसका ब्लड प्रेशर ज्यादा आ रहा है, ठीक है, ब्लड प्रेशर ज्यादा आ रहा है और उसके शरीर का तापमान जो है टेम्परेचर है, तो जैसे 98.6 वगैरह नॉर्मल रहता है, तो उससे ज्यादा है 99 या 100 आ रहा है, 101 आ रहा है, ठीक है। तो ये क्राइटेरिया से अपन उसको संतर्पित आमवात बोलेंगे, ठीक है। संतर्पित आमवात जब भी बोल सकते हैं उसको कि उसका टेम्परेचर थोड़ा ज्यादा रहेगा, उसका बीपी ज्यादा बढ़ा हुआ रहेगा, ठीक है। और फिर उस पेशेंट को अपने को क्या करना है कि पाचन उष्ण तीक्ष्ण ऐसे प्रकार के उष्ण तीक्ष्ण दीपन पाचन द्रव्यों से उसकी चिकित्सा करेंगे। और दूसरी जगह पे अगर एक पेशेंट आता है उसको आपको हाइपोथर्मिया मिलता है, ठीक है, यानी 98.6 समझ लो टेम्परेचर, उससे कम है, 96 है, 95 है, 97 है, ठीक है, तो डेफिनेटली उस पेशेंट का ब्लड प्रेशर भी डेफिनेटली कम रहेगा, ठीक है, उसको हाइपोथर्मिया रहेगा तो डेफिनेटली ब्लड प्रेशर भी कम रहेगा। तो आमवात का पेशेंट रहते हुए भी उसको ऐसे रुक्ष या उष्ण तीक्ष्ण या तीपन पाचन द्रव्य एकदम हाई पावर वाली मेडिसिन नहीं दे पाओगे। तो ये सब देखना है कि पेशेंट का व्याधि रुग्ण बल देखना है, ऋतु देखना है, ये सब देख के संतर्पणोक्त व्याधि है, अपतर्पणोक्त व्याधि है, ये सब देख के ही अपने को जो है वो चिकित्सा करनी चाहिए। ठीक है, ठीक है, तो अपन आज का डे है ओस्टियोआर्थराइटिस, तो संधिगत वात के बारे में अपन देखते हैं। तो योगरत्नाकर में संधिगत वात के बारे में कुर्यात संधिगते वात दाह स्वेद उपनाम। ठीक है, तो जनरल कोई भी जो आर्थराइटिस है, ठीक है, तो आर्थराइटिस है तो एक कॉमन लाइन ऑफ ट्रीटमेंट जो बोलते हैं अपन वो संधिवात में जो है ये योगरत्नाकर के श्लोक में है। तो अपन स्नेहन करेंगे, जो आभ्यंतर भी कर सकते हैं, स्नेहपान कर सकते हैं, या तो बाह्य स्नेहपान भी कर सकते हैं। ठीक है, स्वेदन कर सकते हैं, नाड़ी स्वेद, गुटी स्वेद, और जो भी अवेलेबल स्वेद के प्रकार है उसमें से स्वेद कर सकते हैं। लेप भी एक पाचन का प्रकार रहता है, तो लेप भी जहाँ पे है ना जॉइंट पेन है, इन्फ्लेमेशन है, स्टिफनेस है, तो वहां पे लेप पाचन के लिए यूज करेंगे। अनुलोम द्रव्य यूज करेंगे, है ना, पेशेंट के हिसाब से गंधर्व की या एरन तेल, और बहुत सारे पेशेंट की प्रकृति के हिसाब से त्रिवृत लेह वगैरह आप यूज कर सकते हो। ठीक है, बाद में रक्त मोक्षण कर सकते हैं, दहन कर्म कर सकते हैं, है ना, जहाँ पे भी टेंडरनेस वगैरह वहाँ पे सुवर्ण शलाका से भी दहन कर्म कर सकते हैं। तो जो है ना संधिगत वात या वात व्याधि में भी ये हर चीज में वात व्याधि में, जैसे पैरालिसिस का भी पेशेंट है, पक्षाघात का भी है, तो उसमें उपस्तंभित वात और निरुपस्तंभित वात। उपस्तंभित वात यानी स्त्रोतरोध जन्य वात व्याधि बोल सकते हैं आप, और निरुपस्तंभित वात बोले तो अपतर्पण जन्य वात व्याधि वगैरह बोल सकते हैं। ठीक है, तो अपन को ये दो मेन टाइप है और उस टाइप के अपन चिकित्सा देखेंगे। ठीक है, तो ट्रीटमेंट आप है ना उपस्तंभित वात, ठीक है, जहाँ पे जॉइंट स्टिफ वगैरह है, तो वहां की ट्रीटमेंट लाइन आप क्या कर सकते हैं अपन। ठीक है, तो अभी तो मैंने बहुत सारे कल्प लिखे हैं, तो ये जरूरी नहीं कि अपन उपस्तंभित वात का पेशेंट डायग्नोस कर ले तो आप भला तक यूज करो, गूगल यूज करो। ठीक है, तो पेशेंट को जैसे मैंने पहले इसलिए बताया कि पेशेंट को हर बार अपने को देखना पड़ता है कि पेशेंट का व्याधिपल वगैरह सब देख के ही अपनी चिकित्सा करेंगे। तो जनरल एक उपस्तंभित वात के लिए अपन जैसे भल्ला तक कल्प है, जैसे भल्ला तक हो गया या भल्ला तक आसव जो अपन यूज करते हैं। ठीक है, उसके बाद में गुड़ में कल्प यूज करेंगे उपस्तंभित वात में, जो भी एक पाचन टाइप में हो, उष्ण तीक्ष्ण रुक्ष टाइप के हो, इस प्रकार के अपन जो है गुगुल कल्प यूज करेंगे। उसमें योगरस गुगुल आएगा आपका, महायोगरस गुगुल आता, त्रिफला गुगुल आता, सिंहनाथ गुगुल आता, रासना, अमृतादि गुगुल और केशर गुगुल। तो ये कैसे है, ये थोड़ा सा उष्ण वीर्यात्मक गुगुल के टाइप से, और ये पाचन करने वाले द्रव्य है। तो उपस्तंभित वात में जो गुगुल यूज करना है तो आपको इनमें से ही गुगुल यूज करना है। ठीक है, बाद में बाह्य स्नेहन करना है तो भी वो पाचन टाइप के ही जो है वो जो ऑयल रहेंगे, जैसे सहचरादि तेल हो गया, कोट्टुम चुक्कादि तेल हो गया, या तो फिर विषगर्भ तेल वगैरह भी यूज कर सकते हैं, सेंधवादी तेल वगैरह से आप स्नेहन कर सकते हैं। ठीक है, तो ये उपस्तंभित वात में करेंगे। बाद में जो उपनाह वगैरह जो चिकित्सा बताइए उपनाह, ठीक है, तो आप जैसे उष्ण वीर्यात्मक कोट्टम चुक्कादि चूर्ण, सेंधव, कार्पासादि तेल, धान्यमलई, इसका मिक्सअप करके उपनाह करके पोल्टिस वगैरह से उपनाह दे सकते हो पेशेंट को। ठीक है, बाद में जो है उपस्तंभित वात में ट्रीटमेंट के लिए अष्टवर्ग कषाय आया है ना, जो भी वात कफग्न और उष्ण तीक्ष्ण प्रॉपर्टी का रहता है, तो आप वो यूज कर सकते हैं। बाद में जो काफी द्रव्य है, रासनाई रंडादि कषाय, अमृतोत्तर कषाय है ना, अमृता देवदार शुंठी वगैरह रहता है इसमें जो है कंटेंट। ठीक है, उसके बाद में गुग्गल तिक्तक कषाय, महामंजिष्टादि कषाय है ना, महारासनादि कषाय, समीर पन्नग, ये सब आप उपस्तंभित वात में चिकित्सा पेशेंट को देख के कर सकते हो। समीर पन्नग एकदम कफ कम करने वाला है तो उसको थोड़ा सा ध्यान से यूज करना रहता है। ठीक है, उसके बाद में ट्रीटमेंट फॉर निरुपस्तंभित वात की चिकित्सा देख रहे हैं अपन। ठीक है, तो निरुपस्तंभित वात में कैसा है, निरुपस्तंभित वात में अपन ने पहले भी देखा था कि मॉर्निंग स्टिफनेस वगैरह नहीं रहेगा इस पेशेंट में, लेकिन होल डे कुछ ना कुछ थोड़ा सा कम ज्यादा वो पेन थोड़ा सा कंप्लेंट करते रहता है पेशेंट। ठीक है, तो ये निरुपस्तंभित वात में कैसा है, पेशेंट को अपने को ताकत भी देना रहता है, जैसे बल्ले, रुष्य, वातग्न और ब्रूहन करने वाला, ऐसा थोड़ा सा ध्यान में रख के अपने को निरुपस्तंभित वात की चिकित्सा करनी पड़ती है। तो उसके लिए अपन सुवर्णकल्प यूज करेंगे। तो बृहत्वाद चिंतामणि वगैरह जब यूज करना है तो कोई भी वात व्याधि है तो यूज कर लिया बृहत्वाद चिंतामणि, तो ऐसा रिजल्ट नहीं मिलता। इसलिए ये समझना चाहिए अपने को निरुपस्तंभित है या उपस्तंभित है। ठीक है, तो यहाँ पे अपन जो निरुपस्तंभित वात या वात व्याधि है वहां पे अपन बृहत्वाद चिंतामणि या त्रैलोक्य चिंतामणि रस जैसे कल्प यूज कर सकते हैं। देखो यहाँ पे सुवर्ण समीर पन्नग यूज कर सकते हैं, क्योंकि सुवर्ण समीर पन्नग तो उपस्तंभित वात में आएगा, लेकिन सुवर्ण समीरपन्नक अपन निरुपस्तंभित वात व्याधि में यूज कर सकते हैं, ठीक है। दशमूलारिष्ट हो गया, अश्वगंधारिष्ट हो गया, ये ताकत देने वाले और वात भी कम करने वाले ये जो एक कल्प है, ठीक है, या तो काढ़े वाले जो भी है दशमूलारिष्ट, अश्वगंधारिष्ट। स्नेहन भी करना है आपको तो महानारायण ऑयल से करेंगे, है ना, जो भी ताकत देगा शरीर को। बला अश्वगंधा तेल, धानवंतर तेल, क्षीर बला तेल। तो ये फर्क है आपको थोड़ा डायग्नोसिस में, उपस्तंभित वात और निरुपस्तंभित वात, ठीक है। तो उसके हिसाब से हर चीज में स्नेहन स्वेदन भी करना है, जो ओरल ट्रीटमेंट गुग्गुल कौन से यूज करना है, ये सब वो ये होता है, ठीक है। और निरुपस्तंभित वात में एक त्रयोदशम गुग्गुल भी यूज कर सकते हैं अपन, जो कटी अधोगत वात में अच्छा काम करता है। और थोड़ा सा कैसा है, इसमें शतावरी अश्वगंधा वगैरह भी द्रव्य है, तो वो शरीर को ताकत भी देता है, बल्ले ब्रून टाइप का है, तो अपन त्रयोदशम गुग्गुल या निरुपस्तंभित वात में यूज करेंगे, ठीक है। तो अपन आज का जो मेन टॉपिक है ओस्टियो आर्थराइटिस, ठीक है। तो ओस्टियो आर्थराइटिस के पहले ओस्टियोपोरोसिस की टर्मिनोलॉजी देखते हैं। तो ओस्टियोपोरोसिस में कैसा रहता है कि जो अपने बोन्स रहते हैं वो एकदम वीक और ब्रिटल रहते हैं, है ना, तो ठिसूल बोलते हैं जिसको, तो इजीली वो फ्रैक्चर वगैरह होने के चांसेस रहते हैं, ठीक है। तो उसको अपन ओस्टियोपोरोसिस बोलेंगे। और उसमें लाक्षा गुग्गुल हो गया, और संधानी गन का काढ़ा या संधानी गन के जो भी अवेलेबल चूर्ण वगैरह है आपको आपके पास में, तो वो आप पेशेंट को दे सकते हो। क्षीरबला आवर्ती, धानवंतर आवर्ती वगैरह भी यूज कर सकते हो, ठीक है। तो ऑस्टियोआर्थराइटिस में क्या रहता है कि आपका जो है ना डिजनरेशन ऑफ जॉइंट विद पेन एंड इन्फ्लेमेशन, पेन रहेगा, इन्फ्लेमेशन रहेगा, और वहां पे डिजनरेशन रहता है, ठीक है। तो ऑस्टियोआर्थराइटिस डिजनरेशन जो है ये तो आप अस्थिक्षय जैसा भी आपके ध्यान में आना चाहिए, है ना। तो उसमें ओस्टियोफाइट्स होते हैं, ओस्टियोफाइट्स बोले तो एक्स्ट्रा ग्रोथ ऑफ बोन, ठीक है। तो अस्थि वृद्धि जैसा लगता है अपने को, लेकिन वो अस्थि वृद्धि क्यों हुई रहती है, ये जो है डिजनरेशन की वजह से, अस्थि क्षय की वजह से। तो अपने को ट्रीटमेंट जो करनी रहती है अस्थि क्षय की करनी पड़ती है, ठीक है। तो इसके लिए अपने को जो गंध तेल वगैरह आता है ना, तो वो गंध तेल यूज करेंगे अपन, या तो गंध तेल की कैप्सूल भी मिलती है मार्केट में, तो वो यूज करेंगे, ठीक है। जॉइंट स्पेस रिड्यूस होती है, तो उसमें अपन उपनास स्वेद वगैरह करेंगे। उसके लिए शुंठी हो गया, शिग्रुस्वरस वगैरह और सेंधव का मिक्स करके उपनास स्वेद वगैरह भी कर सकते हैं, उससे भी अच्छा रिजल्ट मिलता है। बाद में कप डोमिनेंट यानी स्वेलिंग और एकदम जॉइंट स्टिफ है तो कप डोमिनेंट बोलेंगे, तो उसके हिसाब से लेप लगाना है तो अपन पट्टम चुक्कादि लेप जो उष्ण तीक्ष्ण वीर्यात्मक जो है वो अपन सोचेंगे या वो करेंगे, ठीक है। और स्वेलिंग और टेंडरनेस यानी स्पर्शशत्व है तो पित्त डोमिनेंट हो गया, तो उसमें फिर अलग अलग प्रकार के थोड़ा सा लेप वगैरह यूज कर सकते हैं, ठीक है। तो गृहोदमादि लेप, नागरादि लेप, कोट्टम चुक्कादि लेप, ये अलग अलग प्रकार के लेप जो है अपन ये ओस्टियोआर्थराइटिस में यूज कर सकते हैं, ठीक है। बाद में एक लंघन भी जो जनरल है ना, निदान परिवर्जन और लंघन हर डिसीजेस में आया, तो जैसे अपन लंघन करते हैं तो कोष्ठस्थ वात या कोष्ठस्थ जो विकृति दूर होती है ना, रिड्यूसेस कोष्ठस्थ वात लंघन करने से। तो ये जो लेप लगाते हैं पेशेंट, तो ये पाचन टाइप का ही रहता है, ठीक है। तो ये भी लंघन करता है, तो संधिगत लंघन यानी संधिगत जो भी दोष रहता है उसका लंघन से वो पाचन होता है, ठीक है। तो इसकी वजह से वो लेप का भी काफी इंपॉर्टेंस है ओस्टियोआर्थराइटिस में, ठीक है। तो अभी ओस्टियोआर्थराइटिस के बाद में अपन ना एक एक जो डिसीजेस है उसको संलग्नित डिसीजेस जो बोलेंगे, सोराटिक आर्थराइटिस हो गया, एंकिलोजिंग स्पॉन्डिलोसिस हो गया, ये सेली हो गया, तो ये देखेंगे थोड़ा कि ये भी वात व्याधि रहती है और आर्थराइटिस ही है, ठीक है। लेकिन लाइन ऑफ ट्रीटमेंट क्या फर्क रह सकता है इसमें, है ना, और क्या थोड़ा सा अपन सोच सकते हैं उसके बारे में, ठीक है। तो सोराटिक आर्थराइटिस यानी क्या रहेगा कि जैसे पेशेंट को एक आध सोरासिस हुआ है और फिर उसको है ना सोरासिस का कॉम्प्लिकेशन होकर उसको आर्थराइटिस भी हुआ है, तो उसको सोराटिक आर्थराइटिस बोलेंगे, ठीक है। तो इसमें सोरासिस भी है, आर्थराइटिस भी है, ऐसा सोराटिक आर्थराइटिस है, ठीक है। तो अपने को उसमें कैसा है, रक्त शुद्धिकर चिकित्सा करनी पड़ेगी, बराबर है। रक्त शुद्धिकर बोलिए, रक्त प्रसादन कर जो चिकित्सा करनी चाहिए, तो उसके लिए आपको सारे वाद्यास हो गया, महामंशदी काढ़ा हो गया, इवन खदेरा रिष्ट वगैरह हो गया, है ना। तो ऐसी जो है वो मेडिसिन यूज करेंगे अपन, ठीक है। रजनियों हो गया, ये सब यूज करेंगे। फिर कुष्ठ और वातरक्त की चिकित्सा का भी थोड़ा विचार करेंगे इसमें, ठीक है। सोराटिक आर्थराइटिस, कुष्ठ और वातरक्त, तो कुष्ठ वातरक्त में भी जो भी बताया है ना, कोकिलाक्ष वगैरह, गुरुचि वगैरह बताया है। बाद में आपको रसमानिके, वंगभस्म वगैरह, ये जो है ना, आरक वदादी कषाय, महातिक्तक कषाय वगैरह जो है, तो वो भी अपन ये सोराटिक आर्थराइटिस में यूज कर सकते हैं। उसके बाद में कफादिक वातरक्त चिकित्सा कर सकते हैं, है ना, वमन करेंगे, विरेचन करेंगे, महातिक्तक घृत का स्नेहपान करके वमन करेंगे, है ना। और फिर विरेचन डेली भी विरेचन गुड़हरित की दे सकते हैं, या तो फिर ये महातिक्तक घृत का स्नेहपान करके अपन विरेचन वगैरह भी कर सकते हैं, गोमूत्र त्रिफला वातका वगैरह भी यूज कर सकते हैं। और सोराटिक आर्थराइटिस है तो थोड़ा वात का तो एक रासना दशमूल कषाय, रासना सप्तक कषाय, कोकिलाक्ष ड्रग ऑफ चाइसिस में, और षडधरण चूर्ण, इसमें चित्रक वगैरह है तो संधिगत आम का पाचन करने में बहुत मददगार होता है, ठीक है। तो ये षडधरण चूर्ण, तो ऐसे सोराटिक आर्थराइटिस जो है तो ये थोड़ा सोचना है कि रक्त प्रसादन चिकित्सा, रक्त शुद्धिकर चिकित्सा और कुष्ठ वातरक्त के बीच में जो भी चिकित्सा है है ना, तो उसको समन्वय साध के अपने को सोराइटिक आर्थराइटिस की चिकित्सा करें तो पेशेंट को जिंदगी भर जो एलोपैथिक की मेडिसिन लेते रहते हैं उनको लेना नहीं पड़ता और काफी जल्दी जो है रिजल्ट मिलता है। फिर है गाउटी आर्थराइटिस, ठीक है। तो गाउटी आर्थराइटिस कैन बी कोरिलेटेड विथ वातरक्त। ओके, तो गाउटी आर्थराइटिस बोले तो जो इमेज है ना, तो यहाँ पे जो है ना क्रिस्टल इंडस आर्थराइटिस उसको और क्रिस्टल जो है डिपोजिशन हो जाते हैं संधियों में, ठीक है। तो कहीं ना कहीं क्रिस्टल होता है, तो आप अगर फोटो भी देखेंगे तो कैसा है वो रेडिश रहता है, बहुत पेन भी रहता है उसमें, बर्निंग भी रहती है। तो ये कहीं ना कहीं ये पित्तक भाव है, पित्त जन्य ये थोड़ा सा गाउटी आर्थराइटिस जैसा रहता है, ठीक है, पित्तजन्य ऐसे आप बोल सकते हैं, ठीक है। तो इसमें ये कोकिलाक्ष ये ड्रग ऑफ चॉइस रहती है ना, कोकिलाक्ष कषाय हो गया उसका ही, फिर गुड़ जाति कषाय वगैरह हो गया, तो ये अपन यूज कर सकते हैं ना। तो एक्सरे वगैरह करने के बाद में इसमें जो क्रिस्टल्स है ना फैलेंजेस में, तो ये डिपोजिशन ऑफ क्रिस्टल्स इन फैलेंजेस दिखते हैं। उसके कोकिलाक्ष गुड़ीचादी ये तो ड्रग ऑफ चॉइस है गाउटी आर्थराइटिस में, ठीक है। उसके साथ में अपन बला गुड़ीचादी कषाय हो गया, महामंजिष्टादी कषाय हो गया, ये यूज करेंगे। और जो गाउटी आर्थराइटिस रहता है तो ये किडनी में जो है जो क्रिस्टल्स रहते हैं वो किडनी में डिपॉजिट या तो उसके थ्रू ही वो निकल पाते हैं, इसलिए अपने को मूत्रल द्रव्य और मूत्रल चिकित्सा करनी पड़ती है पेशेंट की, ठीक है। तो उसके लिए तृण पंचमूल कषाय हो गया, पुनर्नवादी कषाय हो गया, है ना, तृण पंचमूल कषाय और रिमूवल ऑफ टॉक्सिन्स फ्रॉम किडनी, ये अपन देंगे, ठीक है। पुनर्नवादी कषाय देंगे, ना हो फिर से क्रिस्टल्स का किडनी में, इसलिए अपन पुनर्नवादी कषाय वगैरह, मूत्र विरेचन पे आते हैं वो देंगे, ठीक है। तो गाउटी आर्थराइटिस है उसका सीरम यूरिक एसिड 6.5 के ऊपर है, और बाकी पे आयुर्वेदिक हिसाब से अपने को पूरे सिम्टम्स दिख रहे, तो गाउट ऐसा आपने डायग्नोस कर लिया तो वो ड्रग ऑफ चॉइस अपने को देखना है कि पित्त भाव है, उसको जलोपापचरण कर सकते हैं, रक्त मोक्षण कर सकते हैं, कोकिलाक्ष ड्रग ऑफ चॉइस है और गुड़वेल ड्रग ऑफ चॉइस है, और बाकी के भी द्रव्य जो है और मूत्रल द्रव्य आपको देना है ना, महामंशदी कषाय हो गया, तृण पंचमूल कषाय वगैरह हो गया, तो ये सब मेडिसिन अपन दे के वो पेशेंट का गाउटी आर्थराइटिस, और उसके साथ में थोड़ा सा मूत्र चिकित्सा है, पैक्तिक मूत्रपुच्छ चिकित्सा, पैक्तिक अश्मरी, पैक्तिक शोक है ना, पित्तज वाले भी जो है मूत्रपुच्छ अश्मरी और शोक, तो ये चिकित्सा कर सकते हैं। और एक विरेचन के लिए जो भी है गाउटी आर्थराइटिस में एक अच्छा ड्रग है कल्याण गुड, तो आप डेली 10 से 20 मिलीग्राम तक के रात को सोते समय कल्याण गुड का यूज कर सकते हैं, ठीक है। और ये फॉर प्रिवेंशन ऑफ गाउटी आर्थराइटिस, यानी जिसका यूरिक एसिड जस्ट मार्जिनली बड़ा है या तो उसको ऑलरेडी गाउटी आर्थराइटिस डायग्नोस है, तो उसको आप डिकॉक्शन भी दे सकते हैं, गुड़वेल, पुनर्नवा, गोक्षीर वगैरह का, ठीक है। तो ये पूरी ट्रीटमेंट हो गई गाउटी आर्थराइटिस, है ना। इसके बाद ना इसलिए देखेंगे अपन सिस्टेमिक ल्यूपस इरिथेमाटोस, ठीक है। सिस्टेमिक ल्यूपस इरिथेमाटोस ये जो आपको इमेज दिख रहे होंगे, है ना, तो ये भी देखने के बाद में एक तो रक्त दोष्टि दिख रही है, पित्त विकार दिख रहा है, और ये वात व्याधि तो है ही, है ना। तो ये सब देख के अपने को ट्रीटमेंट करना है ना। तो अपने आयुर्वेदिक टर्मिनोलॉजी से ये थोड़ा सा कैसा विसर्प टाइप में भी जो विसर्प प्रसरणशील रहता है ना, डिसीज बढ़ते बढ़ते जाता है, तो उसमें की कुछ मेडिसिन लगेंगे, कुष्ठ में जो भी कुछ मेडिसिन है वहाँ की मेडिसिन लगेंगी, जैसे महातिक्त कषाय वगैरह हो गया, आरक वजादि कषाय वगैरह हो गया, उस टाइप की मेडिसिन। रक्त प्रसादन भी चिकित्सा लगेंगी, सारे वाद्य जैसा हो गया, महामंशदी काढ़ा वगैरह हो गया, है ना। और थोड़ा सा ये अंतर्विद्र की चिकित्सा टाइप में भी करनी पड़ती है, जैसे सुकुमार कषाय वगैरह हो गया, है ना। और फिर वात का तो ये रहता है वातरक्त चिकित्सा, गुड़चर्या कषाय वगैरह, तो ये सब लाइन ऑफ ट्रीटमेंट देख के, लाइन ऑफ ट्रीटमेंट हो तो पेशेंट का डायग्नोस करके, ये तो एसिली डायग्नोस के लिए अपने सर ने जो भी बताया आगे सर ने कि तो एंटी डीएस डीएनए वगैरह वो सब टेस्ट कराने के बाद में अपन जो कंफर्मेटेड रहता है, और अपन साइन एंड सिम्टम्स की वजह से भी पेशेंट को समझ सकते हैं कि ये एसिली है, तो ये चिकित्सा अपन थोड़ा सा कर सकते हैं। विरेचन भी देंगे, पित्त रक्त का दृष्टि देख के, जैसे त्रिवृत्त लेह हो गया, त्रिफला चूर्ण वगैरह हो गया, तो इन सब मेडिसिन से अपन जो है विरेचन कर सकते हैं। तो क्या एसिली में क्या है, तो कुष्ठ और एक विसर्प का थोड़ा सा ये रहेगा, विद्रधि का भी थोड़ा सा विचार करना पड़ता है इसमें, और वातरक्ता का, ठीक है। और एनेमिक तो रहता है ये पेशेंट, इसलिए फिर पांडव्याधि का भी थोड़ा सा, तो इतने तिक्त कषाय हो गया, दाढ़ीमादी ग्रोथ, सुकुमार कषाय, गुड़चर्या कषाय, ये सब मेडिसिन अपन यूज करेंगे इसीलिए के लिए। इसके बाद में एंकिलोजिंग स्पॉन्डिलोसिस, ठीक है। एंकिलोजिंग स्पॉन्डिलोसिस में आप ये इमेज देख रहे होंगे कि ये नॉर्मल एनाटॉमी है, स्पॉन्डिलोसिस का ये एक्सरे MRI है, ठीक है। तो एंकिलोजिंग स्पॉन्डिलोसिस को अपन बाम्बू स्पाइन वगैरह बोलते हैं, एकदम वो स्तब्धता आ जाती है, ग्रीवा स्तब्धता, अनुस्तब्धता, है ना। तो ये कटिग्रह वगैरह भी रहता है, तो उसको अपन ये जो है एंकिलोजिंग स्पॉन्डिलोसिस हो गया, तो ये थोड़ा सा ट्रीटमेंट करने के लिए काफी, यानी कि ये थोड़ा सा असाध्य टाइप में ही रहता है, या तो इसको ट्रीटमेंट करने के लिए बहुत ज्यादा टाइम लगता है, ठीक है। तो कैसा है कि ये ग्रीवास्तंभ, कटिग्रह वगैरह ये सब जो है सिम्टम्स दिखते हैं इसमें, तो अपन उसको थोड़ा सा दीपन पाचन टाइप के जो है वो मेडिसिन देंगे। फिर ये अच्छा काम करने वाले धानवंतर 101 या शिरबला 101 ये मार्केट में मिलते हैं, धानवंतर 101, शिरबला 101 ये अच्छे से काम करते हैं एंकिलोजिंग स्पॉन्डिलोसिस में, तो ये अपन यूज करेंगे। अब साथ में पंचकर्म में मन्नावस्थी हो गया, ग्रीवावस्थी हो गया, नस्ते वगैरह और उत्तर भक्तिक स्नेहपान वगैरह है ना, तो ये राशना दशमूल घृत से, तो ये अपन एंकिलोजिंग स्पॉन्डिलोसिस में कर सकते हैं। तो बेसिकली चिकित्सा करनी है और चिकित्सा करनी रहती है, और धानवंतर 101, शिरबला 101 और साथ में पंचकर्म पेशेंट राहत दे सकते हैं आराम से, ठीक है। तो इसमें भी दो कंडीशन रहते हैं, एकदम ही वात कंडीशन रहती है तो स्नेह स्वेदन और मृदु शोधन करेंगे, और आवृत्तवात कंडीशन यानी कफ का आवरण हो गया या तो फिर है ना, तो स्त्रोतरोजन्य या संतर्पणजन्य ऐसे लग रहा है तो अपन को ये जो है दीपन, पाचन, रुक्षण, स्नेह स्वेदन, शोधन और उसके बाद में जो है रसायन चिकित्सा करनी है ना। तो ये तो यहाँ पे भी है, और बाकी पूरे प्रकार के वात व्याधियों में, ऑस्टियोआर्थराइटिस में संतर्पित है पेशेंट तो अपने दीपन, पाचन, रुक्षण करना है, स्नेहन, स्वेदन, शोधन, और बाद में पेशेंट अच्छा भी हो जाता है तो उसको रसायन चिकित्सा देना है। और केवल वात कंडीशन हो गई या तो निरम वात हो गया तो उसको स्नेहन, स्वेदन, मृदु शोधन से ट्रीट करेंगे। तो रसायन चिकित्सा बोले तो जो भी एकाध व्याधि है उसको अपने ट्रीट कर लिए है ना, ट्रीट करने के बाद में उसको फिर से वो वात व्याधि होता नहीं है, या तो जो शरीर का वात है कभी जाता ही नहीं बोलते शरीर से, तो ऐसा कुछ रहता नहीं है। एक पर्टिकुलर टाइम के लिए ट्रीटमेंट देने के बाद में उनको पेशेंट को जो है वो कुछ टाइम तक के रसायन चिकित्सा भी देना रहता है। तो रसायन चिकित्सा में आप गुड़ुचि रहता है ना, तो गुड़ुचि, शिरपा की घृत वगैरह थोड़ा सा 2-3 महीने के बाद लिए भी बाद में पेशेंट को सुबह 1 चम्मच, शाम को 1 चम्मच ऐसे दे सकते हो। विदर आदि घृत भी दे सकते हो, राशना दशमूल घृत भी दे सकते हो, चतुर्बीज वगैरह भी आमवात का पेशेंट को वगैरह, आमवात थोड़ा यानी कि आमवात के पेशेंट में आमवात का जो सिम्टोमेटिक रिलीफ मिलने के बाद में कुछ महीनों तक के चतुर्बीज वगैरह भी खाने के लिए बोलते हैं, तो वो भी रसायन चिकित्सा है और उसका अच्छा रिजल्ट मिलता है पेशेंट को, ठीक है। और आयुर्वेदिक थोड़ा सा कैल्शियम सप्लीमेंट्स जो है वो जैसे बैद्यनाथ की कैल्सिफिट टैबलेट आती है, धूतपापेश्वर की अस्थि पोषक वटी आती है ना, कुकुट भस्म हो गया, प्रवाड़ भस्म, मुक्त वनशंख, शोक्ति, कपर्तिक वगैरह ये भी कैल्शियम सप्लीमेंट्स है, कामदूधा, प्रवाड़ पंचामृत वगैरह हो गया, तो ये भी कैल्शियम सप्लीमेंट्स आयुर्वेदिक हिसाब से दे सकते हैं। तो ये मेरे तरफ से छोटी सी कोशिश थी, ठीक है। थैंक यू सर।
Thank you very much, Amit sir.
Thank you, sir.
We can take later on. If Amol sir is with us, then he may proceed with his leftover part.
Okay, sir.
I'm ready. I'm ready now, sir. Am I audible, sir?
Yes, you are audible.
So shall I continue my presentation onwards?
Yes, please proceed.
Okay, thank you, sir. I think we have come to this slide. Sir, please let me know on what slide the connection was get.
Yes, this slide we covered, and you are supposed to go on next slide.
Okay, okay. So on this slide, we have seen that it is not necessary to give the name to each and every disease at all times. If we know the hetu, lakshana, if you know the adhishthan of that vyadhi, we can proceed for the medicine. So this is the particular hetu I would like to elaborate in the next slide, that hetu sthana visheshascha bhavet vyadhi visheshakrut. This is the particular srotas. Now, in this slide, we see a man with his circulatory system. Now, if this is the sole hetu in this man, like blood clot is the particular hetu. If this hetu is the single one, and this blood clot get lodged to the various parts of this person, the person may suffer with the various disorders. For example, this blood clot, that is the embolus, if it gets lodged into the brain, the patient suffers with the hemiplegia. If the similar hetu get obstructed into the heart, the patient develop myocardial infarction. If the same hetu get obstructed into the lungs, patient suffers with pulmonary embolism. And the same hetu, if it get obstructed in the lower limb, in the legs, the patient suffers with the deep vein thrombosis. So the hetu is single, but the adhisthans are different. That's why the patient is suffering with different types of disorders. That's what I'm trying to highlight, that it is not necessary to give the name to particular disease every time, because there are so many disorders, we cannot name all the disorders. That's what that particular sutra has mentioned. So coming to the next slide, we are heading towards the anatomical and physiological view of Sandhi joints. We can see these two images on our PPT. The first image, we can see this proximal bone and the distal bone connected with each other through a membrane called as synovial membrane, and a fluid, a lubricant fluid, a viscous fluid is present in this synovial membrane called as synovial fluid, which helps the joints to prevent the friction of the joints and gives the strength and lubrication to the joint. Now in Ayurveda, the synovial membrane is called as Shleshma Dharakala, and the fluid, that synovial fluid, is called as Shleshak Cuff. So on the basis of this Shleshma Dharakala and Shleshak Cuff, we can say that joints are anatomically cuffage in nature. Joints are anatomically cuffage in nature. But when we see the second image, the function of joint is to flex and to extend the limb. And this flexion extension, that is prasarana akunchana, is performed by vata. Particularly Vyanvayu. Vyanvayu has the functions of gati, apakshepan, utshepan, nimesh, unmesh, nadika. So anatomically joints are cuffers, but physiologically, or we can say functionally, they are vatas. So combining these two images, we can say that the most of the disorders occurring in joints are kapha-vatas. Most of the joints, prayah, not all of these, because there might be a pittanubandha sometimes, but most of the time the disorders occurring in joints are kaphaj, vatas or kapha-vatas. We can conclude on this slide, anatomically they are kaphaj and physiologically or functionally they are vatas. Coming to the next slide. Now, how to find dosha prominence from the lakshana. If a patient is suffering from a particular disease, we don't know what that disease is, but on the basis of the manifestations or the symptoms the patient is suffering from, we can find the predominance of dosha, and accordingly we can treat that dosha. For example, if the patient is complaining of pain, we can say that the predominant dosha here is vata, and we all know that. Second, if the patient says that his pain or his swelling is fluctuating in nature, it means vruddhi hani, sometimes it gets enlarged, sometimes it gets shrinked. This kind of fluctuation always occurs due to the predominance of vata dosha. If the patient is suffering from pain as well as tenderness, so the pain manifested by vata, tenderness is pitta dosha. So we can say that here the predominance of Vata Pitta dosha is there. If the patient is suffering from, if the patient is suffering from Sparshasattva, that is the tenderness, and after the local examination, if we see the Ushna Sparshattva or Arakta Varnata on that joint, we can say it is a Pitta predominance manifestation. Next one, tenderness plus swelling. Tenderness is by Pitta, swelling is by Kapha. Similarly, swelling plus stiffness is particularly Kapha Pradhan. Or Supti. Supti means if the patient is complaining of numbness at particular joint, we can say that it is a Kapha predominant and Vatanubandha Vikar. So on the basis of Lakshana only, we don't know what kind of disease patient is suffering from, but on the basis of Lakshana only, we can find the predominant dosha in his body. So this slide is very, very important for the students and for the upcoming practitioners, that again, do not try to name the disease every time, but try to find the dosha vitiation, the predominance of dosha in the body. Point clear in this slide? Coming to the next slide, stages of Sandhi Roga. Now there are no any stages are given in Ayurveda, but on the basis of my tiny knowledge in this portion of knowledge in the Ayurveda, I have find and I have categorized the stages of Sandhi Roga as acute, subacute, and chronic. We can see these stages in this image also. The first stage is early stage, that is acute stage. Second stage is subacute or intermediate stage, and third stage is chronic or late stage. Patient come to the OPD in between any of these stages. We just have to find what kind of dosha predominance is present in his body at that time. If the patient is coming in acute stage stages always have Kapha and Ama Pradhanata. As we all know that Samulam Sarvaroganam Ama Mitya Vidyate. And we have already seen that Sandhis, joints are Kapha in anatomy. So it is very, very easy to get Kapha vitiation at the joint. So in acute stage, there is a Kapha predominance and Ama predominance, and the manifestation is swelling with pain. So in acute stage, patient comes with the swelling and pain. Now, due to this Kapha and Ama, it leads to the Strotovrot, and the Dhatumala Sanchay occurs at that place. Due to this Dhatumala Sanchay, there is increase in the Ushna and Tikshna Gun at that joint. This Ushna and Tikshna Gun increases Pitta at that place. This Pitta is responsible for Paka. Paka is nothing but inflammatory changes. Where we can see rubor, calor. Rubor is redness, calor is increased local temperature. Now, this Pitta is continuously in the contact of that particular bone or joint. This Pitta, due to its Ushna and Tikshna properties, erodes that bone slowly. Now, this erosion we can describe as degeneration of that bone or Kshaya. And when there is a Kshaya or degeneration, there is a Vata predominance. And this Vata predominance in chronic stage can be seen in the third stage. This image shows Vata predominance because there is a ulnar deviation. Any deviation in the bone or any deviation in the body is caused by Vata predominance. So if the patient comes to us in acute condition presenting swelling and pain, we can find that there is a Kapha and Ama predominance. If the patient comes in subacute stage, there will be a Pitta predominance, and the manifestations are of Paka inflammatory changes, rubor, calor will be there. And if the patient visits us in the chronic stage, there would be a Vata predominance because there will be a degeneration or Kshaya already happened. We can see this degeneration or Kshaya through this ulnar deviation or bone deformities. So these are the stages, and accordingly we can treat the patient on the basis of these stages. Coming to the next slide, now we are starting the main portion, the role of Panchakarma in this Ayurveda. So Chikitsa is classified into the main two parts, Shodhana and Shaman Chikitsa. Shaman Chikitsa includes oral medications and Rasayan. Dr. Amit Barbudhe have already highlighted these topics. Now we are focusing on Shodhana treatment. Shodhana Karma, we know Shodhana are only 5. Vaman, Virechan, Basti, Raktamokshan and Nasya. But for better understanding, I have divided this karma in two parts. Bahi Parimarjan, external or local karma, and the second one is Anta Parimarjan, internal or systemic karma. Bahi Parimarjan or external local, it includes Lepana, Abhyanga, Parisheka, Ruksha Svedana, Upanaha, and Avgaha. While in Antaparimarjan, systemic, this is particularly Shodhan. We can administer Virechana, Basti, and Raktamokshana. So we are going to learn each and every part in detail. So first, Bahiparimarjan, external or local treatments we are going to see, in which the Lepan, Abhyanga, Parishek, Ruksha Svedana, Upanaha, and Avga are included. The first part is Lepana. We can see this in image. Lepan is always done in the initial stage of the disease. Initial stage means that acute stage where ama and kapha predominance is there. The aim of this lepana is to reduce the swelling and pain. We have already seen in the PPT that in acute stage, swelling and pain are the predominant manifestations. The lepan acts like Langan for joints. In Ayurveda, almost in all the disorders, the primitive treatment which is advised is Langana. Why Langana? Langana is particularly Ruksha Gunatmak, and this Langana pacifies the ama and elevate the Agni. Similarly, in the joints also, when kapha and ama predominance is there, we can apply the lepana, and this lepan acts like Langan because the lepan are Ruksha Gunatmak. Why we have chosen the lepan dravya having Ruksha Guna property? Because there is a kapha and ama predominance, and kapha and ama are Snigdha Gunatmak. So we have to administer a drug which is opposite in its property. So kapha and ama are Snigdha, so we have to choose Ruksha Gunatmak medicines. So on the basis of dosha pradhanata, we have mentioned the particular drug for lepana here. If the patient is having vata predominance, nagaradi churnam is used for lepana. If the patient is having pitta predominance, means rubor, calor, inflammatory changes are there, we can administer jatamayadi churna lepana. And if there is a kapha predominance, we can have kottam chukkadi churna lepana. I have also mentioned the important drugs in Nagaradi Kashai, Shunthi, Vacha, Sarjarasa Kumari, etc. In Jatamayadi Kashai, Brahmi, Ushira, Ashwagandha, Pushkarmula, and in Kottam Chukkadi, where Kottam means Kushta and Chukkadi means Suntha. So Kottam Chukkadi Churna has main content Kushta and Sunti, as well as Vacha, Shigru, Lasuna, Devdaru, and Sarshaf. We can use all these medicines on the basis of that dosha pradhanata. So Lepan, remember, Lepan is done in initial stage of the swelling. Initial stage of Sandhiroga. Second is Abhyanga. Now, if there is a vaat, if there is a kapha and ama predominance, we cannot use Abhyanga because Abhyanga is also Snigdha. So it will aggravate the disease. So Abhyanga is always performed after Lepan. Abhyanga is always performed after Lepan because we have reduced the swelling due to by administering Lepana. Now, as the swelling subsides, only the pain as a symptom remains there. And to reduce this pain, we use Abhyanga. Abhyanga is done by Tela. Again, on the basis of dosha, we have mentioned the various tel here. If there is Vat predominance, Dhanvantar tel can be used, which includes Balamul, Dugdha, Dashamul, etc. drugs. If there is a Pitta predominance, Pinda tel can be used, which contain Madhushishta, Tila Tela, Manjishta, Sarjas, and Sariva. Only these 5 contents are there in Pinda tel. And if the kapha predominance is there, Kottam Chukkadi or Karpa Sastadi Tailam can be used. Kottam Chukkadi we have already seen in the Lepan also. That is the same drug and the oil preparation which is used for kapha dosha predominance in Abhyanga. So Kottam Chukkadi in kapha predominance, Pindatel in pitta predominance, and Dhanvantar tel in vata predominance. Also we can use Narayan tel. Narayan tel is balya. It gives strength to the joint. And the Mahavisha Garbha tel is particularly used in Amavata, where Ama and Vata, these are the main culprits. So why Mahavisha Garbha is used in only Kapha and Vata? Because it has the Vishadravya like Vatsanab, Uchla, Datura, Arka, etc. These are Ushna Tikshna properties. So Mahavisha Garbha tel should be avoided in Pitta predominant conditions and should be administered in Vata and Kapha predominant conditions. So after Lepana, we are administering Abhyanga as local treatment. The next one is Parisheka. Parisheka is nothing but Snehayukta Svedana. You can see in the image also. So this Parishek is used in the advanced chronic Vata Prokop. So we have administered Lepana to reduce the swelling. As the swelling reduced, we use Abhyanga. If there is a chronic Vata Prokop, instead of Abhyanga, we should go for the Parisheka. This is also Snehayukta Svedana. For Parishek, we can use Dashamula Kshira, for which it has been written that it is Sadhya Shugula Nivaranam. Also, Dhanyamla Dhara can be performed. This Snehayukta Swedan can be performed in the form of Janudhara, Janu Basti, Kati Basti, Manya Basti, Prushta Vansha Basti, and Pishinchil on the basis of location of the disorder. So this is Parishek. The next one is Ruksha Sweda. Ruksha Sweda is particularly given in Kapha and Ama predominance. The famous example is Valuka Potali Sweda. Now this Valuka itself has a Lekhan property because it is Ruksha in nature, and after heating it acquires the Ushna and Tikshna property of that heat. So due to this Ushna, Tikshna and Lekhan properties, it unleashes the Strotorodha, which is caused by Rasa, Kapha, Ama, Kleda. And as this Strotorod nullifies, the nourishment to the joint increases, enhancing the nourishment to the joint and reducing the pain, tenderness, stiffness, swelling, and the restricted movements of the joint. So Ruksha Sweda is particularly performing Ama and Kapha predominance. This is very, very important. Next point is Upanaha. We can see in the image how that Upanaha is applied. It reduces swelling, stiffness, and severe painful restricted movement. But Upanaha can be mainly is used in singular joint involvement. If all the joints are involved in a particular disease, using Upanaha will be cumbersome job. So if only a single or two joints are involved, we can use Upanaha. If there is a swelling predominance, we can see the drugs. If there is swelling, we can use Nagaradi Churnam plus Sandhava plus Dhanyamla plus Narayantel. Mix all these medicines and use Upanaha. If there is a stiffness more, if patient is complaining of stiffness more, then Kuttam Chukkadi plus Sandhava plus Dhanyamla plus Karpasastadi. We can mix this all the medications and use for the Upanaha. There are two notes I have mentioned here. If the patient having Kapha and Ama predominance, we should not use Sneha in this Upanaha. Like in swelling, we have used Narayana Tel. But if there is a Kapha and Ama predominance, this Narayana Tel should be excluded from this medicine list. And the second note is Avagaha is used when the multiple joints are involved. As I already said, that Upanaha is used only singular or double joint, two joints are involved, but multiple joints, when they are multiple joints are involved, Avagaha would be the better option for this. So up to this, we have learned the Bahi Parimarjan, external treatments. Now coming to the Anta Parimarjan, or what we particularly call it as Shodhana. So there are three types of Shodhana we can use in such patients. First is Virechana, second is Basti, and third one is Rakta Mokshana. Now, what is the importance of Shodhana in such conditions? Charaka and Vagbhat have mentioned the same sutra. Charaka in Sutrastan 16, Vagbhat in Sutrastan 4. They mentioned that Doshaha Kadachit Kupyanti, Jita Langana Pachanehi, Jita Shodhanairehi, Tuna Tesham Punarudbhava. Once you administer Langan, Pachana, and Shaman, the dosha may get elevated. But if the patient continues the Hetu Sevan, they may get vitiated again. But if you extract those dosha from the body through Sanshodhana, then the dosha accumulation will be less. So this is the importance of Shodhana mentioned in Ayurveda. The first Shodhana which we can use is Virechana. The sutra, the principle for this is Vatasya Upakramaha Sneha Svedo Sanshodhana Mrudu. Vagbhat Sutrastan 13. The reference is Vatasya Upakramaha Sneha Sveda Sanshodhana Mrudu. Sneha Sveda we know, but Mrudu Sanshodhana is also carried out in Vata predominant conditions. Now since Vata is Ruksha Gunatmak, we have to use such Virechak drug which have opposite property, that is Sneha Gun. So for that Sneha Virechan is used by Eranda Sneha. This is again one sutra mentioned in Charak Chikitsa Stan 29. Vata Shonita Kshirena Eranda Tailam Va Prayogena Pibennaraha Bahu Dosho Virekartham Jirne Kshira Odanashraya. We have to use Eranda Tail mixed with a milk, lukewarm milk, and administer the patient. So this is Sneha Virechana. If there is a Kapha and Ama predominance, we can use Ruksha Virechan also using Triphala and Kshaudra. The sutra is Trifalayaha Kashayam Va Pibeta Kshaudrena. We have to prepare a decoction of Triphala and then add Kshaudra in it, and we can use for the Virechan. So for Vata predominance, Eranda Sneha is used. For Kapha predominance, Triphala is used for the Virechan. The next is Basti. I have mentioned particular bastis here. Erandamuladi Niro Basti. The reference is from Charak Siddhistan third. And the Falashruti in this Erandamuladi Niro Basti is Jangho Uru Pada Tika Trika Prushta Shula Kafarutti Maruta Nigrahamcha. Particularly, it pacifies the pain in the various parts of the body. Second is Mustadi Yapan Basti. The reference is taken from Charak Siddhistan 12. The Falashruti is Shiro Ruja, Janu Ruja, Jangha Graha, Basti Graha, Ashmari Unmad Arshaha, Prameha Admana, and next is very, very important. Vatarakta, Vata, Rakta, Pitta, Shleshma Vyadihara. Mustadi Yapan Basti can be administered in Vata Vyadhi also, Rakta Vyadhi also, Pitta Vyadhi also, and Shleshma Vyadhi also. Along with it is Sadhya Balajanano. It gives strength to the body, to the joint, and it is also used as a rasayana. So rasayan can be used in basti form also, not only in oral forms. So Mustadi Yapan Basti acts as rasayan also. These two are Niro Basti. But we can administer Anuvasan Basti also if there is a Vata Prakopa condition. If there is a Kapha and Ama, we use Niro Bastis only. If there is a Vata predominance, we use Anuvasan Basti along with this Niro Basti. So after these two Niro Basti, I would like to focus two famous Bastis. First one is Vaitaran Basti and second one is Kshar Basti. I think all of us are familiar with this Vaitaran Basti, which is particularly used in Amavat. The bold portion is particularly important. Shula Anaha Amavataharam. Vaitaran Basti is used for Shula, Anaha, and Amavataharam. And Kshar Basti is also used for Shula. In Vangasen, he has mentioned that in Amvat, you have to administer Kshar Basti along with Sandhavadi Anuvasan Basti. So the last line in this slide is Sandhavadi Anuvasasya Kshara Basti hi Prashasyate. So these are the two Basti which are particularly used in Amavat condition, where Ama and Kapha predominance is there along with the pain. Now, both these are Niro Basti. These are a form of Niro Basti, and we all know that Niro Basti are administered in empty stomach. But Chakradatta has mentioned, please focus on this line, Vaitarana Kshar Basti Bhukte Chapi Pradiriyate. These are the two Bastis which are having Niro properties, but these are administered after meal because they are Ushna Tikshna Basti. That's why they are administered after meal. So Vaitaran Basti and Kshar Basti are very, very important Bastis. This is the table which shows the ingredients and their amounts, their pariman. So first is Kshar Basti and second one is Vaitaran Basti. You can just overlook this. Kshar Basti has Amlika, Guda, Sandhava, Shatava, and Gomutra. Vaitaran Basti also have Amlika, Guda, Sandhava, Tiltel, and Gomutra. Just the quantities are, the variation is in the quantity. Next, after Virechana and Basti, the last one is Rakta Mokshana. Now Himadri has mentioned about the Rakta Mokshana that Tesham Annesham cha Vireka Adinam Upakramanam Tat Sadhyeshu Amayeshu Siraveda Pradhanadama. Siraved is Pradhan treatment as compared to Vireka Adi Panchakarma. He has also mentioned that Siravedam Chikitsardam Sampurnam Va Chikisitam. Siraved is half treatment. Like Charak has mentioned that Basti is half treatment. Similarly, Hemadri has mentioned that Siraved is also a half treatment. The next important is given in Charak Chikitsa Stan 14 Arsh Chikitsa. In this shloka, Charak mentions that Shitoshna Snigdha Rukshat Dehi Na Vyadhi Upashamyati Rakte Dushte Bishakam Tasmat Raktam Eva Avsechet. If the physician is administering all kinds of treatments, may it be Shita, may it be Ushna, may it having Snigdha property, may it having Ruksha property, still the patient is not getting relief. The physician should consider that there is a Rakta Dushti in this patient and he should go for the bloodletting, that is Rakta Mokshana. And for Rakta Mokshana, we know there are 5 modalities in Ayurveda mentioned: Shrunga, Jaloka, Alabu, Siravar, and Prashana. Now, if the patient is suffering from Sukti, numbness, Kandu, itching, and Chimchimayana, tingling sensations, then Shrunga and Alabu should be used for bloodletting. If the patient is suffering with Ruk, Daha, Shula, Toda, means pain with burning, then Jaloka should be used for bloodletting. And if there is a Desha Vrajata Stravyam, if the patient is suffering shifting pain, then Siravir or Prashan can be used for the Rakta Mokshana. Alabu, Shrunga, Jaloka, and Prashan are localized Rakta Mokshana, but Siravir is generalized Rakta Mokshana. If there is a dose Drushti all over the body, then Siravir can be used. So this is Rakta Mokshana. Last one is Shaman Chikisa, Rasayan Chikisa, Vardhaman Pippali. We can use Bhallatak Rasayan. We can use in Kapha-Vata predominance, which already have Dr. Amit sir have enlightened on this topic. The last point is conclusion. So on this basis, I would say that periodic Shodhana means that Virechana, Basti and Rakta Mokshana plus regular intake of Rasayan along with Shaman treatment, as well as diet modification and lifestyle modification. And the most important, Nidana Parivarjan, it interrupts the samprapti of disease. It impairs the further progress of disease. It has lesser impact of the disease on the body. It avoids the relapse of the disease. It delays the age-related degeneration of the joints, and it enhances the immunity and general health of the patient. So regular use of Shodhana in the patients of Sandhi Roga, along with Rasayana, diet modification, lifestyle modification, and Nidana Parivarjan are very, very important. Thank you so much.
Hello. If anybody want to ask the question, they can ask to our expert, Dr. Amol Khatri. Otherwise, we will have a now out of thanks. Hello. Hello. Am I audible to all? Hello.
Yes, sir, you're audible.
Yeah. If anyone wanted to ask any question regarding the physiopathology treatment part or any part of this topic, osteoarthritis, one can ask. So we will give the 5 minutes for question answer session. Participant, please. Okay, I think nobody wants to ask any questions. So I would like to express special thanks to respected Dr. Subhash Rage sir, principal of our college, for organizing such a wonderful continuous medical education series, especially for today's topic, osteoarthritis. So special thanks to Dr. Rage sir. And next, our speaker, Dr. Amit Barbudde sir, working as an associate professor in our college, for his outstanding lecture today's topic. He has elaborated very well with a very in a simple manner on various aspects of osteoarthritis by making a superb presentation. So thank you, Dr. Amit Barbudde sir, for highlighting various aspects of osteoarthritis. And I also would like to thank Dr. Amol Khatri. Trouble in network issue, he managed well now to elaborate various and I think very comprehensive management of the osteoarthritis, along with the detailed procedures involving while treating the osteoarthritis, especially with the Panchakarma. And he very nicely presented with the practical aspect of the management of osteoarthritis. So on behalf of our college and being a vice principal of the college, I especially thank Dr. Amol Khatri sir. So, and once again, lastly, I would like to thank all the participants who joined for these wonderful sessions. So thanks one and all who are here for listening to the session, as well as who presented very nicely on this topic. So thank you one and all, and especially I forgot, really, I'm sorry, Dr. Srikant Hadole, who is always help us for a technical expert, and he's also director of technical solutions. So thank you, Dr. Srikant Hadole sir, for giving us assistance in technical management of all these workshops since long. So thank you, Dr. Srikant sir. So thanks and all. So conclude here. Thank you all.
Thank you, sir.
Thank you.